Good afternoon, everyone, and thank you all for visiting our webinar today. And I will first talk about the value of values in co-creating smarter living environments, which I will do on behalf of our Utrecht University team. We are coordinating the valuation co-creation activities in work package 2 of the Gatekeeper project. And well, after my talk, my colleagues Alex Peine and Carla Greubel will also be available to address any of your questions. So let's now start with the talk. So values and valuation. Well, the first question, of course, is why should we look at values in the Gatekeeper project? And today I want to talk to you about values and even more about the value of values in innovating environments for an aging society. And what is important in my talk today is that values should not be mistaken for value. So value can be considered as an often economic or social social word of a good or an action, while values are underlying such words. And values become illuminated in our daily practices and in the social relations in which the good, the actions are, if we talk about the Gatekeeper project, the technologies, so to say, are being valued and are embedded in. So values are everywhere around us. And when we think about it, we can probably all come up with values that change during our own life, values that are important or have been important. And at moments when people we care about are being threatened, for instance, or when someone close to us gets ill, then we only want them to feel better again. Or if we think about any other life events, if I think about my own life, the moment that I became a parent for the first time 4 years ago, the happiness and safety of my child became much more important than anything else. But also it created new challenges, like finding a new balance as a family, rediscovering some own personal space, and also dealing with the ideals and ideas others have about being a parent and raising and caring about a child. So while we all renegotiate our own ideals and values all the time, for example, when we face practical challenges in getting the day organized, we also compromise these ideals. So then I decide just to let my kid watch television to buy me some time to have a meeting, for instance, as I also prioritize other things than just caring about them. So, and also now with the COVID-19 pandemic, we all can think of values that we discovered to be important or that changed as we are asked to balance our own individual ideals and ideas about a good life with the health of others. And wearing a mask, for instance, is not just an obligation that is forced upon us by the government, but also is a way to show some kind of good citizenship, that we care for the health of others around us. Well, at the same time, you can also say, well, it can quickly become a tokenistic action when the mask is never washed or refreshed. So although health or remaining healthy or as healthy as possible has become a core value and for some even a condition for the success of many of the aging innovations and ideals, we should also think about other values. And it has been shown in previous research, among others by Micah Lowe in a paper in 2015, that health is not always necessarily the top priority or issue for older adults as users when talking about comfort in old age. And in another researcher, Tamar Sharon, an associate professor in the philosophy of technology, recently had an online lecture in which she discussed that we should become aware how health has become a super value in our society and how it thereby also affects or even sidelines sometimes other values like autonomy, privacy, and justice. And I'm not going to repeat her talk here, but I do believe many of you are aware of the criticism that comes with digital technologies and AI, but what I think is important to share here is her advice that we should be aware of these different individual and also public values, so not only the individual values, but also the public values that are at stake when new technologies are introduced. And although Sharon argues no one could or would argue against health in itself, it is important to reflect on how values like autonomy, agency of people change when they are constantly being monitored, and also to consider deficiencies like the bias in AI technologies recognizing faces, or the apps that scan for skin cancer that are better in detecting cancer on lighter skins. What we do want to add here today is the importance of attending to values and how values change, how they interact with each other, and how they're and with their context, and how we should keep talking about this continuously to increase the potential success of the Gatekeeper project. So after this long introduction, let me now share you some details of our work in the Gatekeeper project. So this is where we started in work package 2. We focused on the broader ecosystem, where we explore stakeholders' positions towards values, for which we developed what we call a valuation approach. And that subsequently is defined in what we call a valuation framework. And I will show you this framework later on. But first, let me start with explaining the different activities or tasks that we did from perspectives finding their origin in the social sciences and humanities and the responsible research and innovation. So that is actually where our work is based in. And based on the literature and also on stakeholder consultations, we developed a framework that we used in the design of a co-creation workshops that were held at 8 different European pilot sites. And by applying these perspectives, these social science and humanities and responsible research and innovation perspective, we aim to contribute to a more responsible innovation and thereby to increase the potential success and scalability of the Gatekeeper innovations and solutions. So throughout the project, we will further develop this valuation approach, and it is now described in a rather vivid framework. And as already becomes clear from my introduction, values are not static or stable, they are dynamic, and therefore we need also a dynamic understanding of values, which is why we came to looking at valuation, and not just values, but valuation practices. And in the workshop, stakeholders actually reflected on these values and valuation practices by thinking about different values from different perspectives, and eventually defining key challenges and opportunities for implementation of Gatekeeper solutions at their own pilot site. So eventually, the valuation approach will feed back into recommendations for innovations in the active and healthy aging domain. But now we started at these pilot sites, and this can only be considered as a start, as an ongoing dialogue is needed with all within Gatekeeper. So the valuation framework that we present here today is actually the starting point of a further valuation discussion that is needed. So this is then the valuation framework. The framework actually provides a way to map and explore values that are deemed important by relevant stakeholders. And we understand values there as being broader than needs and requirements, as the values underlie these needs and requirements and often guide the actions of the stakeholders. And of course, also the citizens to which the innovations are targeted. And the valuation framework helps to detect these different and dynamic positions, and thereby also to find possible implementation pathways for innovations such as the Gatekeeper solutions. The framework is based on 3 main pillars, the ones you see on the screen now. So we have value multiplicity, value dynamism, and valuation implications. And when it comes to multiplicity, well, values such as privacy are always plural. They have different meanings for different people, but also for one person, they can have different meanings. And they are also dynamic. They change, and interpretations change, life events affect how and what values play a role. Values interact with other values, and you might face contextual changes like the COVID-19 pandemic this year. Value multiplicity and value dynamism both affect the implications of values and valuation practices. They can create tensions, problems, or conflicts. For example, when privacy has to be compromised to encourage a person to work on his or her health prevention in order to remain healthy. And by applying the valuation framework, what is considered to be important in society, it is the with which I mean the society to which innovations are introduced, can not only be detected, but also better understood when it is further explored. So together with stakeholders, a reflection is possible on how these possible implications might affect the further development of the innovation in practice, and thereby a strategy or a pathway to anticipate these implications can be defined together. And this implementation pathway is only sustainable if developed in co-creation and when an ongoing attention to values and how they change and interact is possible. So the co-creation workshops actually organized by the different European pilot sites can be just considered as a first step. So let me go further with the co-creation workshops. In October and November, the 8 remote co-creation workshops were organized by the European Gatekeeper pilot site. And I will now present some preliminary reflections from our side following their first presentations. And after that, I will share with you our vision and ideas about the next steps for the evaluation approach within the Gatekeeper project. Well, what came forward in several of the workshops was that care was discussed as needing to be citizen-centered, with the citizen in control, having autonomy, and also an opportunity to self-manage. The home and the social environment are presented as facilitating places, but individuality was also discussed, for instance, in relation to data collection or data use, and also how these provide opportunities to improve personalized medicine. What we also noticed is that there are underlying tensions in a search for a balance between a focus on an older person as a patient or as citizen, but also when it comes to the role of the formal and informal carers and the broader social environment. So how to balance these different roles. In their discussion, stakeholders also in some of the workshops showed that they search for a balance between the more medical oriented care ideas and ideals when talking about aging. So on the one hand, they focus on how to overcome the health deficiencies that people often face when getting older, versus the discussion that what older citizens want or should want is to remain actually meaningful and socially active. And the question then is, especially in a challenging time like the time we are living in right now, how to facilitate in-person human interactions while technology increasingly enters the home and makes these interactions less common practice than they were. Well, many of the technologies identified as key technologies for Gatekeeper are already available. So in many of the workshops, smartphones and even smartwatches were mentioned as key technologies by stakeholders. And they also mentioned how they are already used by many people, but especially future users will probably have less problems to use these technologies as they have much better digital skills. And maybe a side note is that some also mentioned that not all older adults will be able to use these technologies due to financial circumstances, for instance. So in this case, financial circumstances highly affect opportunities for use. Well, the expectation is thus that future users in general will probably have much better digital skills, and that having to use such a technology won't be a real barrier anymore. So in the workshops, participants were asked to reflect on different perspectives, and they reflected on their own current professional perspective on what is important when it comes to aging at home, the perspective of an older relative or neighbor, and also their own future perspective. So when you are aging yourself, what is then important? And we found that there is a difference in how stakeholders talk about aging at home and place, and the ideals they attach to active and healthy aging. So some values like privacy mean a lot to some, but way less to others who already share their information via commercial monitoring apps, for instance. And also what active and healthy aging actually means is interpreted in diverse ways, where some see a huge responsibility for people to take care of themselves and actively engage in their own health prevention activities. Others rely on doctors and other professionals, or prioritize other things in their daily life over this taking care of themselves. So it was then also asked what older citizens or some people think themselves when it comes to aging at home. And in some workshops, it was discussed that according to participating stakeholders, older citizens, so the participating stakeholders said that older citizens are actually skeptical about innovations in their neighborhood, or suspicious when it comes to sharing their personal information. We started all the workshops with this everyday life scenario I sketched before, with the 3 perspectives, to think not merely about technology as solving specific needs, but to facilitate a broader discussion on solutions. And when looking at these different perspectives, we can conclude that in many places, technology already plays a very important role in the life and futures of European older citizens. Solutions that were discussed in the workshops went beyond the health prevention, early detection, intervention. Feeling safe and secure, for instance, were mentioned as very important in the home, but also in the community, for instance. And it was mentioned that it is highly important to make people feel at home. But then again, there are varying interpretations of what safe and secure means. And some feel safe and secure when they know others look after them when they are being monitored, for instance, while others have would be more comfortable at home when not being watched at all, and not having an alarm button available to call in help. What we achieved in the co-creation workshops was that we actually raised an awareness of the importance to include multiple perspectives, and in defining implementation pathways and thinking about aging, technologies and the home environment, the stakeholders actually did that. So it is a first step towards a reflective approach on underlying values, in addition to paying attention to what often was already done, to needs and requirements. And between the different workshops, we saw a lot of similarities, but obviously their specific context vary, and this situatedness needs to be considered as well. Well, overall, we noticed it was found important to pay attention to the social and societal context, and to have an eye for the dynamic ideas and ideals of active and healthy aging. So this shows actually the importance of being reflective and talking about values, and brings us to the question, how then to embed this valuation approach in the Gatekeeper project. Well, the reflection on underlying and dynamic values is a starting point, as it also helps to become aware of these situated and dynamic multiple values in the everyday lives of older people. We would like to state that this approach to consider what is important in the everyday life could be added as an additional overarching approach to the already existing approaches that we see in the Gatekeeper project. And in this way, we can embed the valuation approach in the Gatekeeper DNA and help different organizations, the Gatekeeper partners, to keep taking this reflection on meaningful places into account. What we see is that there are already two value approaches. One in relation to experiments that are conducted and for which KPIs are developed to show their benefits or the so-called treatment value. And the second is the business model that focuses on having medically beneficial or health prevention increasing interventions that build on an assumed business value. And both values, the treatment and business, are assumed before. And so their actual values will become visible in practice, but they are based on an expected value before these trajectories are started. And we now add an overarching approach that includes, among others, both fields, but also a broader context of everyday lives. And well, the values we are talking about can only be found in practice and are dynamic and multiple. So when we zoom in on these values and reflect on the workshop outcomes, we assume reflecting on values helps to meaningful implementation in everyday context. So we notice tensions between values like an acceptable form of prevention and risk detection versus privacy, ideals of aging that differ, like playing an active part in remaining healthy versus not prioritizing health or relying on medical care. The role of humaneness, social interactions, connections in everyday life play a role as well, and also how care is organized, how integrated care could contribute to values about good care, to health provision. And of course, there are many more values to be found in practice. But to summarize, what we see is that the previously mentioned treatment and business values, and you see them on the left bottom, well, they become actually visible in practice, and that is within the dotted lines. And there is where we can find all the everyday life values that we aim to find with the valuation approach. Well, a further embedding of the approach is not simply done. The workshops were a good start, but we now depend on multipliers, and for these we need the support and input of all within the Gatekeeper consortium, and we can help with this, but and we can help to reflect, but we cannot define the input that is needed for this. So we need to bring this approach now further into the Gatekeeper project to enable an understandable and actionable outcomes. And by creating stories, for instance, in addition to just sharing outcomes and briefing relevant partners in presentations like the presentation I am giving today, we can do that. But most importantly, an ongoing dialogue with all Gatekeeper consortium partners is thus needed. So valuation should become part of the Gatekeeper DNA. And we therefore need to initiate an ongoing process to embed this reflective approach to become part of the DNA, and then to have it feedback in a continuous dialogue on values. Well, this will also be an important point of our agenda for next year, but for its success, we just depend on all of you. And I want to end my talk by briefly looking at our agenda for the upcoming period. So we are working on two deliverables now. One is the valuation framework that actually describes the framework I presented to you today. And the other one is a report on co-creation workshops that basically bundles all the summary reports of the different co-creation workshops that are held in October and November throughout Europe. And the consultation of both draft versions is already planned. Both deliverables are due at the end of January, but you will all have a chance to look at the drafts beforehand. Then we also started an in-depth qualitative analysis of the workshop outcomes, and the outcomes of this analysis will be shared sometime early 2021. And the last thing on the agenda for now is a second cycle of workshops at the end of year 2, start of year 3, that we are starting to design. And in the meantime, an ongoing attention is of course needed, and not only for the partners in the large scale pilot cluster, but also in the other clusters. And we need dialogue between these clusters on the value of values in the Gatekeeper project. So thank you all for now for your attention. And if there are any questions, we are happy to answer them.